Always seen that people, they consider emergency medicine a backup option. It's undervalued. Do you believe there's any truth in that?
There is a systematic flaw which undervalues emergency medicine. So that is the reason, I think.
Emergency medicine is completely hospital dependent. There is no scope of actually doing something on its own.
So most of the scope of practice is hospital based, because if you really want to practice emergency medicine, you need to have systems in place for you.
Why would you advise new person, a NEET PG aspirant, to actually choose this branch as their career?
You get very good salary from the get-go, and you don't have to follow up on the patients long term.
Did you ever go through a moment of self-doubt, regret or anything?
Thoda self-doubt hona is okay, not a big deal, but you need to learn how to deal with it.
What would you say, how much does an emergency physician earn in our country? We are going to discuss about the most emerging branch in India in this podcast, emergency medicine. We have got a specialist who has done his DNB from the prestigious Apollo hospitals. He's a TEDx speaker, and his page, Resuscitate India, focuses on training medicos for life-saving procedures. He is Dr. Manish Taneja. He's a brilliant speaker, a person who has seen emergency medicine branch grow from scratch to where it is today. A strong believer that emergency medicine is going to be one of the top branches in the upcoming 10 years. And we are going to discuss everything about emergency medicine with the specialist today. So let's put our hands together and let's welcome Dr. Manish Taneja. So boss, welcome to our show.
Hi. Thank you, Dr. Nachiket. Thank you for inviting me.
So boss, we are doing this particular branch, this today's podcast, because I believe emergency medicine is one of the most undervalued branches. We are going to discuss in detail about that branch. But before we get into that, I would like to know everything about you. Like, I know you come from a first generation, doctors. And was medicine actually your first choice in career?
It rarely happens that medicine is first choice in career, except for like maybe mere bete ke liye ho jaye, because he's going to see me as a doctor growing up. But for me, it wasn't. I actually grew up in a small town in Rajasthan, Bharatpur. So our house was very close, in very close proximity to the district hospital. So everybody, all the doctors used to live around us, and the kind of respect that I saw in the 90s while growing up, they were getting. I was intrigued by the idea. And then, like a movie, it just happened. Reality is stranger than fiction. So I joined a tuition class in my 10th standard, and the science teacher was not very old. He was around 26, 27 when we were 15, 16. So maybe a 10 years age gap. He was very good, very loved by all of us, was like basically an elder brother, was like a friend. He had this condition, he had a cyanotic heart disease. He had a VSD, which I can recall now because I'm not sure, I wasn't a doctor back then. I don't know what it was really. So he had a cyanotic heart disease and he died while he was, one day, suddenly he died before our exams, like I think 20 days before our board exams. And it was devastating. It was heartbreaking. And he wanted to be a doctor. So that sort of, added a layer on top of that intrigue which I already had when I was growing up. And then my father, when we, finished our 10th standard, choti jagah thi, so most people were like sort of moving out for higher studies, for coaching and whatnot. So those guys, most of my friends, they were going for engineering. And my father was like, why don't you try medicine? And because probably he also saw the prestige that, medicine had attached with this, and, our neighbors were doctors and all those things. So I think that sort of pushed me into it. And then I decided to, okay, let's try it. Let's give it a try. And that's how I ended up becoming a doctor. So, yeah, it wasn't my first choice. I wanted to be a herpetologist as a child when growing up, but living close to National Park and all that. But yeah, I ended up being in medicine.
That's quite an inspiring story.
Yeah.
So the burning question, why emergency medicine? I am sure at that time you must be having several other options. Choosing emergency medicine, I would say that's a bold step. Why emergency medicine?
Yeah, definitely. I mean, I did my emergency medicine from Delhi, so you need to get a decent rank to get a seat in Delhi. So I had other options if I wanted to, but my first job was in emergency medicine. Just out of internship, I joined junior residency, uh, at AIMS Delhi in the emergency medicine department. I tried to get into the department for a, so AIMS used to happen every 6 months. So for 2, 3 attempts, I tried to get into AIMS, but I couldn't. So the next best thing in Delhi was to join a DNB program. So I joined that. Emergency medicine from the get-go intrigued me very much. I come from a very average or a mediocre college, a private medical institution, and we used to refer those cases. Many of the cases which I was handling on day one in the department at AIMS. I mean, under supervision, obviously. So it intrigued me a lot. I was fascinated by the whole prospect of it. The things some of the senior emergency physicians were doing, like, third year MD resident or like an SR. It was amazing. I mean, I actually felt like a doctor for the first time because they were actually saving lives there, in front of me, in front of my eyes, it was live. And that feeling, that adrenaline rush, I had never gotten it before. So I decided that emergency medicine was the thing for me, was the choice for me.
I've been into the counseling procedure of, NEET PG aspirants for so long now. And I've always seen that people, especially doctors, of course, they consider emergency medicine a backup option. It's undervalued. Do you believe there's any truth in that?
Yeah, definitely it's undervalued. I mean, not just by doctors, even by the systems, even by the hospitals, it's definitely undervalued. I mean, just by the fact that we have like what, maybe 200, 250 seats of MDDNB emergency medicine throughout the country, even. And it was started pretty late. It was started in, I think, 2010, 11, or maybe 15 was the first emergency medicine residency with it was in BJ Medical College, Ahmedabad. I think it was 2014, 15, if I remember correctly. So it's definitely undervalued. It ranks low on the choice list. People don't understand it, people don't get it, and there is a power tussle because lot of the department people, the traditional medicine specialities, they don't want to lose control of the area of the place which emergency is. So handing over the control of the department to different speciality is not acceptable, because we are a hierarchical system, and we have hierarchies in our in our society, in our practice, in our day-to-day life. So we don't want to lose that kind of control, and talk or deal with somebody else. We want to have control over our intakes, our admissions, and all those things. So yeah, there is a systematic flaw which undervalues emergency medicine. So that is the reason, I think.
I'll ask you a very layman question. This is for a younger audience who want to know in detail about this branch. So the layman question is very simple. What is the basic difference between the traditional branch of medicine and emergency medicine?
Emergency medicine is not an OPD based branch. Okay. So traditionally, medicine is considered an OPD based branch. With, obviously they have the hospitalist privilege, which means that they admit patients under them and they treat them. So OPD based practices are considered a priority or a choice, or the first choice in our country, because that private practice can build you a lot of revenue if you go ahead. Right? Emergency medicine is considered a dependent branch because you need a lot of systems or lot of infrastructure in place to function. You need a cardiologist, you need a cath lab, you need CT machines, you need X-ray machines, you need ultrasounds, you need point of care lab testing. So a lot of systems are required in place for you to function or do the work that you do being an emergency medicine physician. While in medicine, it is not true. You can sort of sit on a table and a chair and have a pen and a notepad, and you can start prescribing medicines, right? I mean, you don't really need a lot of input. So that is why OPD based specialties are a preferred choice in our system, in our country. And that is why emergency medicine, that is how emergency medicine differs from medicine in the first place. Secondly, obviously, the scope of practice later on in the future, as in when you super specialize or sub specialize, like in India it's known as super specialization, but rest everywhere else it's called sub specialization. So when you go for super specialization or sub specialization, you have more options being a medicine physician compared to an emergency medicine physician, which obviously it's a systematic problem, because think about it. An emergency medicine physician is seeing a patient come to him with chest pain, diagnosing an MI, knowing how to read the ECGs, thrombolizing the patient. Should he not deserve to become a cardiologist if he wants to later in the future? Or a nephrologist, the patient is coming in the overload, he's diagnosing hyperkalemia, he's initiating the dialysis. So should he not become a nephrologist if he wants to tomorrow? But obviously systematic changes or our systems are like that in place that he or she cannot. So that is where emergency medicine lacks in terms of medicine as compared to medicine, in my opinion.
So are you saying that this particular branch, the emergency medicine, is completely hospital dependent? There is no scope of actually doing something on its own?
No. I mean, so most of the scope of practice is hospital based, because if you really want to practice emergency medicine, you need to have systems in place for you to do the thing that you do. Like, you basically support the care of patient when they are grievously injured or critically ill, right? And you need systems in place to manage those kind of patients. But you definitely can do your private practice. You can be a general physician. You can open an OPD. You can do a hospital based practice. You can open your own setup if you want. I know a lot of people who have opened their own setup, and they are making good money, or they are having a thriving practice. So I mean, it's not like the scope is not there, but to do the kind of practice that emergency physician does, you need systems in place, or you need infrastructure in place.
I've heard a lot of cons about this branch from you. I mean, compared to traditional medicine, this field, I believe, is limited. Why would you advise a new person, a NEET PG aspirant, to actually choose this branch as their career?
There are certain negatives associated with every branch, but there are positives as well. So in emergency medicine, the positives are you get very good salary from the get-go. I was getting more money compared to my friends who finished their PG in maybe orthopedics or maybe surgery or maybe even medicine as an SR. And then you have shorter working hours. So you work for basically 6 to 8 hours a day, and those are definite. Once you go home, there is no calling you, nobody calls you back. So that is there. You have adrenaline filled shift, and you don't have to follow up on the patients long term. So if you are kind of the person who has sort of the ADHD, who doesn't like, following up on the patient for a very long period of time, emergency medicine becomes one of the best specialties for you. And that is why in many other countries, it is a preferred choice, because people want that kind of work-life balance that emergency medicine allows you. So emergency medicine has those pros as well. And the cons obviously are there with emergency medicine, like with any other specialty. It is a high stressful environment. Your patients are at their worst, their family is at their worst behavior. So you go through those problems. You have to, there is a lot of violence associated. When have you ever seen violence except in the emergency room of the hospital, right? So there is a lot of violence associated with emergency medicine. There is, it is undervalued in the terms because it's not a direct revenue generating branch for a hospital. So sometimes your pay over a period of time they have ceilings, so they don't increase as much. So there are cons associated with emergency medicine as well, like with any other specialty.
Isn't this the irony that the branch which has emergency in front of its name has limited working hours of 6 to 8 hours per day?
So emergency medicine requires a high stress environment, right? I mean, the whole environment is very high, very stressful, because if there are a lot of negative emotions and negative stress associated with working in a high stress condition. So when you go through it for a very long period of time, you sort of get drained. And also there is unpredictability. You never know what is going to come out of that, walk in through those doors. If there are 4 patients together, or if there are 10 patients together, if there is a truck which was collided with the bus, you might have a disaster at your hand. So there is unpredictability. If by chance we have longer working hours, let's say 12 or 24 hours or 36 hours shift, you are not going to function at your best. And obviously, in the situation where you require to think on your feet, or you are required to have that kind of versatility where you can manage from a pediatric patient to an elderly or trauma, you need to be well rested. You need to think it through. Your brain should not be fogged. And it has been shown time again by the studies that when you do longer working hours, you have brain fog. You don't function as well. So that is why emergency medicine and critical specialties which involve taking care of the critical patients should have shorter working hours instead of longer working hours.
I'll ask you this question. I was just talking to you and thinking about this one, that since this field is actually meeting a lot of disasters on a daily basis, I'm sure the mortality rate on bed, on table for the patients must be very high. Isn't it very emotionally taxing for the doctors?
Definitely. I mean, emergency medicine should only be pursued by those people who are highly stable or emotionally stable, right? Who have a outlet to vent out their emotions when they can, or they can process their emotions much stably compared to other people, because if not, you're going to get burned out sooner than later. And burnout is the most common issue with emergency medicine throughout the world, not just in India. That is why there are always jobs available for emergency physician in the UK or in the US or in the Canadas or even in UAE. Many emergency physicians, they move out and they work in those countries. So because it's a high stress environment, there's a high burnout rate, you always have job available. So that may be a negative, but it becomes a positive you think about it in the long term.
I won't say it's a positive or something, because I can relate to it very deeply, because now many of my friends have completed their own PG post graduation and are now working as an SR.
Yeah.
Till you are into post graduation, you are still not responsible for the patient directly. But when you become an SR, somehow responsibility comes on to you. And I know that even if a single one of them loses a patient, I think that's the disaster for them in itself. For a week, they're still talking about it, because in their minds, they are not able to lose that thing, that how did we manage to lose that patient? So imagine the same thing happening on a daily basis when the patient is coming to you on the worst condition possible. I still remember during my internship days, I remember an RTA case that, like, it was, I can't even, it was just the end of the day, and I was just standing at the person, gave up on the table in front of me. And I still think about it. So I believe, again, this is my advice to everyone, that if you're thinking of choosing emergency medicine, please know it's a very, very emotional taxing job. The trauma that you're going to face daily, it is not going to be easy. And we think that it's going to be easy, but it doesn't. It's still back of the mind. You still think about it a lot. Okay, we lost a patient on the table today.
Repeat it all over again.
Was, how would you define? And I think this is the most important question of our podcast. And I'm going to ask it in the early stage only. I won't wait till the last. You said that it's a really well paid job. What would you say? How much does an emergency physician earn in our country? In just after completing the post graduation, after 10 years, after 20 years?
Just after finishing your post graduation in a metro city like Delhi or maybe like Mumbai, you can expect upwards of 1.5 lakhs to approximately 2 lakhs, not beyond that most of the time. So unless you're lucky. Once you are down in the branch for like 5-7 years, you sort of become a junior consultant or a consultant depending upon where you are practicing, and you can expect 3-4 lakhs And this is where most of the people start experiencing ceilings. Because it's a dependable branch, there are ceilings associated with dependable branch. Most of the hospitals don't want to spend a lot on the people who don't generate direct revenue, which is actually a misnomer if you think about it. And if you are like higher up, if you are like head of the department after 10 years or something, or if you are like leading a group of institution and sort of their chair of department or head of combined group of hospital or something like that, then you can obviously make higher money, maybe up to upwards of 7 8 10 lakhs a month or something like that. But that not everybody will reach there. So you can expect a ceiling of approximately 4 5 lakhs for most people per month.
What are the job possibilities in this branch?
Obviously, as an emergency physician, you're supposed to work in the emergencies, right? Definitely. But you can have your own private practice. You can have your own private setup as well in tier 2, tier 3 cities. Especially it becomes very difficult in tier 1 cities because there are the competition is pretty high. And then you can have like your private practice as well, a small scale OPD kind of practice. You can have that. You can become an educator. You can, other things. Medicine people are also becoming a content creator like you, like an influencer. So you can do all of those things. So emergency medicine, the scope is like any other branch. You can choose to practice traditionally in your own specialty, or have become a businessman or an entrepreneur and have your own private setup, or you can have like a small scale OPD kind of setup, or you can choose to become influencer, or you can delve into AI and all those things. You can solve those problems. You can get into academics. You can become a professor. All those options are available.
Between government and a private hospital, which area has the maximum potential for emergency medicine?
Right now, it was earlier. It had become that emergency medicine should become a one of the essential specialities for a hospital to have if they want to have MBBS seats, 100 or plus, something like that. But that rule has been taken back by the NMC. So many of the hospitals have already started the Department of Emergency Medicine, either private or government, even in the corporate. But it is not necessary for them to have the Department of Emergency Medicine. So many of the hospitals will have sort of stopped scaling it when they were at what level they were a few years back. So the problem with government jobs in any specialty is that there is a ceiling or there's a cap of earning, right? But the good thing about the government job is you have like sort of fixed hours, and once you become senior, like a professor or associate professor, you get more into academia compared to actually seeing the patients. So that if you want to do something like that, then obviously government hospitals. Private hospitals, the ceiling is much higher. Ceiling is always there, but ceiling is much higher. You can make more money. You can become head of department faster than a government hospital, and you can but the academics are not very well defined in private hospitals, so you end up seeing patients for a very long period of time. If that is something which you don't want, then obviously uh, government is better. If that is what you're looking for, then private is better.
Let's talk about MD and DNB in this branch.
Yeah.
What is the basic difference between doing an MD emergency medicine and DNB emergency medicine?
There is no difference at all. I mean, the only difference which you will feel is when you do DNB from a hospital which is less than 500 beds, you will need to do one extra year of SR-ship. If you do, I usually tell people go for an MD in the hospital which is old, which is like in a big city, and you have a lot of good exposures. So national level institutes like INI institutes, so go for them if you are getting MD in them, or like some of the big ones like MAMC or something like that. So if you are getting RML or something, you're getting something like that, go for MD in those. If you're not, it's better to do DNB, especially non-surgical branches in hospitals, in large corporate chains like Max or Apollo or something like that, uh, compared to doing MD in a tier 2 or tier 3 city hospital. So that is what I usually tell people. because those hospitals are mostly more than 500 beds, so you don't have that extra year of SRship at your hands, and you get good exposure in them compared to a district hospital from a tier 3 city or something like that. So yeah, I don't think there is any difference between MD and DNB in today's day and age.
So can you tell us top 5 institutes for doing MD emergency medicine and DNB emergency medicine?
MD in the INI institutes like AIMS Delhi, or AIMS Rishikesh, AIMS Jodhpur, JIPMER, uh, and MD in Manipal, KMC Manipal. So those are some of the good ones. CMC Vellore, St John's. DNB, go for the big private chains which have established DNB for a very long period of time, like Apollo Chennai, Apollo Delhi, Apollo Hyderabad, Max Saket. Those are the really good ones.
What are the super specialization options for this emergency medicine?
They're not a lot. Okay. Uh, Probably in 10 years that should change. But right now, you can do DM in critical care, but not in AIMS, not in INI institutes. Emergency medicine is not recognized as a feeder specialty for DM critical care in AIMS, but through NEET SS you can. Okay. And you can do DM in genetics, disease, and all those things. And you can do DM. There are few very obscure specialities which have come up in these INI institutes recently, like DM in high altitude medicine. It's there in AIMS Rishikesh. You can go for that as well. Then there is post doctorate fellowship in pediatric trauma at AIMS Bhopal or AIMS Jodhpur, pediatric emergency medicine, that is also in one of those AIMS. So you have these options currently, but I think that should change over the next 5-10 years.
Are there any fellowship options also post graduation?
Yeah, I mean, critical care fellowships are also there, and there are, like I said, postdoctorate fellowship in pediatric trauma and pediatric emergency medicine. Those are also there, and many other are coming up. But obviously, right now it's a new specialty, so not a lot of options are there, and also there is systemic slowdown or like a sort of compression, which people are not ready to sort of open up those specialities for emergency medicine. They don't want to recognize emergency medicine as a feeder specialty as of now, but that should change with some period of time, because emergency medicine will sooner or later gain the traction and gain the recognition that it is lacking currently.
What do you think is a 10-year future for this branch?
Future is bright. With increasing population of India, we will need more emergency physicians to manning up the departments, because the trauma rates are really high in our country. You need somebody who's trained in trauma to take care of you when you are at your worst. The rate of MI is high in our country. Diabetic nephropathies are very high in our country because of the sheer number of diabetics in our country. So you will need dialysis and all those things. So if you have somebody who is trained and can take care of all those things from the beginning, the moment you step in the hospital, that is an asset, and sooner or later people will realize it, and the number of seats and the number of positions will go up as the population progresses.
How would you describe your own residency days? Would you call it toxic? Would you call it non-toxic? Or would you call it, hectic, or just, it worked upon? How was it?
So residencies in general, nobody likes their residency. It's a pressure cooker, right? So traditionally, residencies are supposed to make you stronger. It's an old concept. Nobody likes going through that in this generation. Nobody likes doing those longer shifts, coming whenever you're called, coming back, and all those things. So I had my issues in my residency, but in general it was fine. My HOD was very supportive, and she understood the requirements, and they tried their best. But obviously we were the second batch in the hospital, so there was a need for improvement in the academics and all those things, so we faced those issues. But in general, I would rate it 7 out of 10, that my residency was decent enough.
Was Apollo in its whole a very sufficient environment?
So if you think about it, it's the oldest chain of hospital which functions at the level, right? And it was the first hospital in India, Delhi Apollo, to get recognition in the country, right? Uh, NABH and all those things which we hear about now, they didn't exist before Apollo Delhi went and did a JCI audit for them, and they were recognized as JCI institution. So obviously there is a standard of care. There is a commitment towards improving the care of patient, and we were sort of we were taught to think of patient before anything else. So that tradition is there, or that kind of care is there, which I used to like, and I still appreciate it. That has made me a better physician overall because of the exposure.
Boss, I'll ask you something. It's a very important question because, many of our audience are the people who are actually thinking about choosing this emergency medicine as their career branch. Now, what would be your advice? What kind of person a student needs to be to actually be successful in this particular branch?
You need to be emotionally stable. The first thing which I said was you need to be very versatile. From trauma to pediatrics to geriatrics to OBGYN, you can face anything, walk in through those doors. So you need to have the versatility. And you need to be accepting of the fact that you might not get that kind of recognition which other specialists will get, even though you have worked equally hard or even sometimes even harder. So if you are okay with those things, you are good to go in the emergency. If you want to enjoy your life, work a certain period of time in the hospitals and then go back home and relax and, get a decent pay or do something on the side, then those kind of people are always, they do well in emergency medicine. They are meant for emergency medicine, or emergency medicine is meant for them.
There's always a question when a new JR1 is entering the department, there are some tips from the senior how to survive in the department. What would be your tips to the new JR1?
Be on your feet, be alert, okay, and listen before you act. Think before you act, and be open to criticism and be open to feedback. So if you do these things, you are going to learn much more. You're going to make friendships which will last for a long period of time compared to when you don't do these things. So yeah, these are my advice to somebody who is joining in the department.
So this is an offbeat question that I'll ask you. You have worked in one of the top hospital chains of our country. I think every top hospital has a lots of flaws.
Yeah.
What do you think that 3 changes you think are required in our own systems in the top hospitals which could actually make our country better?
I think equitable profit sharing should be talked about in terms of when we talk about those large corporate chains, because doctors do most of the work, but they do not get the kind of profits that the hospital chain makes. So that should in future should be talked about or should be thought about, I think. As doctors are becoming entrepreneurs, or they think about money and all those things as well. So that should be talked about. Also, there should be equitable sharing of recognition. So if I have done the work, if I have, let's say a patient walked in, a 25-year-old with cardiac arrest walked in or was brought in, we did a hour-long CPR or ran a code for 1 hour, and then shifted the patient was revived, and we shifted the patient to the cath lab, and cardiologist opened the LAD or whatever, there was an MI, he opened the artery, cardiologist opened the artery. So most of the recognition will be given to the cardiologist will get all the recognition, but the emergency physician down there, he will not. So it rarely happens that somebody comes back to me and says thank you for saving my life. So that should happen, I think. And also we should think about working on the security even in the corporate hospitals, because emergency is prone for violence. So improving safety so that we don't have to think about ourselves before thinking about our patients. So that should happen, I think.
Have you met with a violent incident till now?
Yeah, many times. I mean, so one of the important things for an emergency physician is to learn how to handle a crisis, right? So crisis management is one of the essential skills which I'm still learning. I am not very good at it. I tend to get angry. Thoda garam khoon hai. But I am still learning. So that has happened. But over the years, I've learned to manage crisis pretty well. So it has never happened that somebody has hit me or something like that. But there has been altercations, there has been shouting, and all those things has happened very frequently.
Would you share an incident?
There was an incident when I was doing my residency. I think I was in the final year or something like that, and a family was brought. A family brought a middle-aged men who came from in the western part of Punjab or something, and had met a road traffic accident few days ago, was brought to the emergency of our hospital, and there was we saw the patient. It was an old trauma. The patient was stable, so we examined and we said, yes sir, we are taking the patient inside, but we will also do an medical legal case, an MLC. Family was very pissed at the fact. They got very angry that we have shown it to 3 hospitals in the last 2 days. Nobody has talked about it. The patient hit the tree himself. Why are you making it a big deal and all those things? We tried to make them understand that it is a necessity. We should, since we don't know how the accident had happened, so we should involve the police. But we are treating the patient irrespective of the fact. So things got out of hand. There was screaming match, and there was some pushing and shoving off the doors and all those things, and there was police involved and all those. So it has happened many times like that, similar scenarios.
Chain like, even in that scenario, this kind of thing happened.
Yeah. I mean, you will find many pictures which have gone viral. It happens with large hospitals. Any other hospital you take it, it happens with all of those hospitals, because people are not in our country. People don't want to wait. Everybody wants, they think that they're paying, right? So they want to get the care immediately. They want the doctors at their disposal immediately. They want them, they want to prioritize themselves irrespective of the fact that there is a triage, or there is a concept of, whoever is sicker will get seen first. Those concepts don't exist in India.
But my actually concern is that when the altercation was happening, wasn't security around to stop it or control it?
They did stop it. Most of the time they take care of the situation, they calm it down. But sometimes it happens that we have to call the police, because obviously, things get out of hand. People get very angry and all those things.
It's scary, right?
It is, but
So
part
you are
and
used
parcel
to
of
it
the
now.
job.
A very important question, looking at everything, the security concerns and everything. So is emergency medicine a right branch for a female?
Yeah, definitely. I mean, some of the best emergency physicians I have worked with are females, and my seniors, 2 of them were female. My juniors are female. My batchmates are female. My HOD was a female. So it's a very good branch for females, because even people realize that you are working in a high stress situation. There is security there. We are worried about females mostly post the Kolkata incident.
True.
Because it has shown that there is a systemic lack of security in our society or in our hospitals or something like that. But when people are there, so emergency is a busy department, right? There are people walking around. There are new patients coming in and out throughout the day, even at 3 a.m. in the night, or 5 p.m. in the evening. There will be patients, there will be doctors, there will be security. So females will be always under the vision. They will always be seen. They will never be alone. So there is, when we think about incident like Kolkata, that happened in seclusion. When people are always around you, when people are present with you, you are very safe. So emergency medicine becomes the best.
But what you are saying holds true for a private hospital. I know that what happened at UCMS when, a gunman entered into the ward itself, held the doctor with a knife on her throat and shot the patient. It happened in broad daylight. Now, when we talk about a situation like emergency medicine, where the everybody is in a trauma state, everybody is hyper, and at that moment the adrenaline is so high in everyone, be the doctor, be the patients. I consider the patient to be in the worst state possible, and especially the attendants. The family is the one which actually creates a ruckus. They are the ones who are going crazy that save the patient, and if the patient actually dies on the table, they go frantic about it, they go hyper about it. And everybody knows there is no security in government colleges, government hospitals. Hardly anybody is there to stop anything. Okay, even if there is, the people of the attendance are so many that they normally tend to choose to stay aside. And at that moment, can we say the doctors are safe?
No, doctors. So, I mean, you
I'm not even
need.
saying male or female. I'm just saying doctors, are they safe?
So, there is definitely a concern for safety when you work under high stressful situations. The only solution to that is to strengthen the security of the whole premise of the hospital. Let people not enter, or let 20 people not come in together or something like that. Those protocols should be there in place, instead of saying that people should not work in a specialty because there is a risk of or safety concern. We should try to improve the safety of the places in themselves. I have worked in many government hospitals as well, including AIMS. Safety was never an issue. There were always guards outside standing at the door of the emergency, and whenever you needed to, you can call. There was a police station inside the compound or inside the hospital itself. And there were always, and like, small chowkis exist even in the trauma center, or even in UCMS, and almost all the places have those things. But yes, we need to definitely work on strengthening our security system so that doctors can feel more safer and do not worry about themselves instead of worrying about the
True,
patients.
true, true. And safety is one of the biggest concern of our doctors right now.
Yeah, definitely.
Man, I don't think government is planning to do anything about it. It's like, let it be. They will shout for some time, then they will calm down again, and then some incident will happen. Even Kolkata incident now, it has been completely calmed over. So this is the way our government works. Something happens, they let it calm, let it cool down, and then see कि अब अगला देखेंगे अगला क्या करना है.
Sadly, that is true for every government.
So again, an offbeat question, and this question came up when we were doing our research on emergency medicine. So I saw this article where a very weird thing was there. It stated that people who have done MBBS and after that have done a simple course of ACLS and BLS, now they are being paid equally to a MD emergency physician. The article was in a very high, what I would say, a good magazine or something. So do you think that is also true?
See, like I said, emergency medicine is not a direct revenue generating branch for the hospital, which is actually not true. So if you end up billing everything under the emergency, whatever procedures you do or whatever medications that you dispose of, you will end up realizing that actually emergency medicine makes a lot of revenue. So what many hospitals will try to do is, since it's not a direct revenue generating branch, they will try to cut down on their expense on the department. They will not give them an ultrasound machine. They will not put a point of care testing in the emergency. They will not hire a specialist. So they will hire somebody who can do sort of some things for a cheaper cost. So obviously the salary will not be the same as the emergency medicine trained physician or something like that. It'll definitely be lower. But when you are starting, right, the salary differences are not very wide, not very huge. So if you are getting, let's say, 1.5, the other guy who is just trained, who has done 1 year some fellowship or course or something like that, or has 1 or 2 years of experience, he will get 1 lakh rupees. So the gap is not very wide. But as you grow up, as you sort of get more training or you put in more years, the gap increases. Those guys will not be able to replace you ever.
Can you share some of the most interesting cases that you have seen in your career?
So I have seen like terrible crush injuries where the whole body below the navel was under a truck tire or something like that. I have seen people who had their main aorta occluded, by a thrombus. I have seen massive brain bleeds. I have seen gunshots. I've seen knife stabbing. I've seen rapes. I've seen a lot of different things. But the things which hurt the most is, when we lose a pediatric patients. So I think one of the reason why I went into critical care is so that I don't have to see pediatrics. It breaks my heart. So yeah, I mean, I've seen some crazy cases in my time.
Again, a very emotional, taxing statement that
Yeah.
is. How do you manage the attendance post a death?
You learn over the years. You realize, like I said, death is an inevitability. Sooner or later somebody is going to die, and your job is to prevent that death. So you are standing between the god of death and the patient. Basically, you can try, but the god will win many times. So you have to accept it. It's an humbling experience. Basically, you have to accept the fact that you are mere mortal. You are just trying to save somebody's life from something which is inevitable, which is bound to happen. So you give your best shot, and whatever happens after that is, well, God's will, not yours.
How do you manage the families, like post their patient's death?
Those are called soft skills. So there are multiple articles, and even in the journals or the magazines, they have been written. There are certain protocols for that. You need to sit them down. You need to talk to them in a certain way, and be direct, but don't try to hide, and all those things, but be gentle. So all of those things you need to do. There are certain protocols for doing it the right way. So, but you have to understand that you have to be compassionate. You have to think not as a doctor but as a human being. You have to be think of yourself in their shoes. So when you do those things and you follow the checklist, most of the times people accept the fact that something has happened, but you tried your best. If you did try your best, I mean, if you were not there and people will see that the patient was there suffering, gasping, and died after 20 minutes, and you were not there, then obviously you can't convince them. But if they saw you trying your best and then something has happened, they will mostly accept it, and they will calm down sooner or later.
So, if you had to rewind your life and you can go back to the day you chose a post graduation career, would you still go with emergency medicine?
Definitely, I will. But I advise people to think it through. You need to be versatile. You need to think on your feet. If you can do all of those things, you can handle the emotional toll. Go for emergency medicine. You will have a happy life, because nobody will be there to call you at the middle of the night if you're not on shift. You can go back home, make decent money, enjoy with your family, live your life. If you want such kind of life, this is the specialty to choose.
Perfect. That's an inspiration. Dr. Manish, we come to the end of a podcast, but it's not really the end.
Yeah.
We still have the rapid fire round. Very simple two rules. One, you have to be super spontaneous with us. I'm sure that you can do that. You're very quick on your feet. And you have to be super truthful.
Okay.
What's the one thing you never leave home without?
My phone, I mean, you know, we are bound to our screens, and
Exactly.
with Instagram and everything, you can't leave it behind.
If you could have dinner with any historical figure, who would it be?
Mahatma Gandhi, I mean, love him or hate him, he was absolutely relentless at what he did, and the kind of patience you need for something like that, I would want to learn the secret, really.
What would you ask him?
How to have that kind of patience. I mean, seriously, I don't have those kind of patience.
What's a hobby or skill you wish to have more time to pursue?
I love music. I play guitar, so I am not giving it enough time these days, and I'm stagnant. I haven't improved myself in very long time, so I think I would like to get back to it and get better at it.
What world secret do you want to know right now?
Seriously, the only secret which I worry about is there a God or not? I'm 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 sometimes torn between existence or no existence, because sometimes you feel like, oh, there is a God, sometimes you feel like there is no God. But I mean, I think I would be able to live my life much more happier if he existed, or if he didn't, if I knew about it, I would be able to do things better.
All right. I'll ask you another question on this thing. 1,000 crores or the answer to this question? What would you choose?
Difficult.
Yeah.
But I think I would still choose the answer, because money can be made, and I don't need a lot to live a happy life. The salary I make, and whatever side income I have, I'm living a comfortable life. I don't really want to upgrade my lifestyle much more than what I have. So I'm content with what I have currently. But if I could get this answer, I think I would be much more happier.
So what I think personally is that, let's suppose if we get to know that God actually exists, we would have somebody to blame upon everything. But let's suppose the God doesn't exist. The whole faith that we have, that at worst time in our lives, when we pray to somebody, that there is somebody who can help us out, that whole faith would be shaken.
Yeah, definitely.
So that means at the end of the line, you're all alone.
Yeah. So faith gives you that power, right, to to persist. Even in the face of adversity, you can persist because of your faith. So if, let's say, tomorrow I realize that God doesn't exist, I know that this is going to end. All of this is just immaterial. So it doesn't matter.
You have to be non-material every day.
Yeah. You just live your life, be happy, and die.
So, all right, Dr. Manish, it was a wonderful podcast,
Thank
ending
you.
with a very deep thinking thoughts.
Thank you for inviting me.
Yes, thank you so much. And thank you so much, everyone, for watching today's show. I believe we have covered everything about emergency medicine in detail from a working professional who has gone through this branch from scratch till who he is right now. So, it's a wonderful podcast. Please share it with somebody who is planning to choose emergency medicine as their career branch. We have covered everything, and I believe a very interesting conversation. Who do you want our next guest to be? Please put it in the comment section, and do not forget to subscribe. We are very close to 50,000 subscribers, and I will have a huge treat for everyone when we get to that ambition. All right. So thank you so much for making Nachiket Bhatia Show a success. Love you all. God bless you, and best of luck.